It's a privilege to catch up with Dr. Daniel Saltarelli from the University of Cincinnati. Daniel, I understand you're an assistant professor in pediatric optometry at the university. It's great you could be here in India and lead this series of workshops in Kolkata and in Chennai.
Thank you. Thank you so much for having me. It's a pleasure to be here in your country. And I really want to thank you and the India Vision Institute for this excellent opportunity.
And I'm always fascinated with the term pediatric optometry. So, for a layperson, could you maybe explain in a nutshell, what
Sure.
it is?
Well, I like to explain it as eye care for little people, because essentially that's what it is. In America, we tend to equate pediatric optometry with binocular vision as one thing, but binocular vision really applies to people of all ages. We do eye care for children, infants, and young individuals that need vision improvement. So.
And how is that different from, eye care issues that adults might have? I mean, when you deal with a child, I mean, is it a whole different...
It is different, yes. It is especially different because a lot of times you are dealing with a child that's not necessarily cooperative, or maybe that you may not be able to completely trust the information that they're giving you. So in pediatrics, we have to learn to be very selective about the information that we get during an eye exam. And we also have to learn to trust our objective measurements, because we can't always rely on subjective measures like you would in a cooperative adult. So,
And what's been the age of the youngest person you've dealt with?
the youngest I've dealt with is probably 1 day old, and that would be a baby after having undergone surgery for cataract removal.
Right.
And usually I'll see them anywhere from 1 day to 2 weeks after that for a placement of a contact lens. And the oldest I will see is anywhere up to 18 years of age.
Right.
But the average child that I see on a regular basis is usually a toddler or entering school age type of child, 3, 4, 5 years of age.
Yeah, and I would presume the majority of young people you see would be probably the age group between maybe 11 or 12 and 18.
I also see a fair share of children in that age range as well. Yes.
And is uncorrected refractive error a big issue in that age group?
It always has been, and it continues to be, yes. That's probably the number one thing that I see, is just children that come in and simply need a pair of glasses. Even at the level of hospital eye care, in clinics in which I work, it's still just needing a pair of glasses as the main factor on corrected refractive error.
Right. And there's a growing theory that current lifestyle is making this a bigger problem than what it used to be before.
Right.
And I was just wondering whether you had any thoughts on that.
Well, I would say that's true to a certain degree. I clearly see that there are both environmental and genetic aspects to the development of refractive error. We see families with a strong history of needing glasses, especially myopia, and you can pretty much tell that the children need the glasses too at an early age just by asking a few key questions to the parents. But we also know from some very good research, some evidence-based research, that tells us that children that spend more time outdoors and maybe less time on computers and with their faces in a book tend to have, on average, lesser amounts of myopia. So there clearly are environmental components there and genetic factors. We also may be seeing more refractive error because we are detecting it more. There's much more awareness about the need for eye care, and we're getting more and more kids into the clinic, and we are uncovering a lot of need. Mm-hmm.
And one final question. So if you want to give some advice to young children, especially in the school growing group, whether it's kindergarten or high school, what would your advice be to them in terms of how they could better look after their eye?
Well, I think children I'd really like to direct that to the parents. I think I'd like to tell parents to make sure that you don't assume that your child has good vision. We often get families that come into the clinic and are often surprised by the diagnosis because their child is doing so well in school. Turns out that they're doing well with the use of just one eye. And children can get by just fine like this. So my advice would be to the parents and to the community at large to implement better education to families about the importance of eye care. And as far as the children, I would say listen to your parents and eat more vegetables. That would be what I would tell little children.
Thank you so much.
Thank you
for your time, and thanks for being
Thanks.
here.
It's a pleasure. Thank you so much.
Thank you.
Appreciate it.